सर बस 5 सेकंड।
हाँ
ये लाइव कर दिया सर।
So hello friends, we are starting a very important session. Hello everyone, hello everyone. Sir, caliber का definition, हाँ, I will tell you, don't worry, है ना? Hello everyone. So the paper of forensic medicine was, I would say, easy to moderate. Hello, easy to moderate. We'll discuss question one by one. Almost 13 to 14 MCQs were there. Hello. हाँ, tough भी कह सकते हो. You can say it is tough also. Yes, tough also. Hello. So we are coming to question number. Hello everyone. हाँ, 14 questions, 13 to 14 questions अपने पास इसके. You can see the question number 1. Good afternoon dear. Good afternoon. थोड़ा टफ था, but फिर भी by notes we can do all the questions, है ना? टफ था, पेपर totally टफ था, tricky था. I would say it was tricky. Life sentence given by which quote we'll discuss. Now I am coming to first question. Yes. It was a case of snake bite on the right foot with the farmer. There was a 2-fang mark with pain and swelling and bleeding at the site of bite. Now tell me, the question was bleeding at the site of bite, or it was the bleeding from other systemic part, epistaxis or some other area? Tell me. Patient was vitally stable. Okay. Patient's vitals are stable. Okay. Patient's vitals are stable. Okay. So that is good. That is a very important point. If vitals are stable, he had 2 bite marks. He had 2 bite marks. Okay. Now, what is your answer here? Tell me, what is your answer? Audio echo हो रहा है. Audio echo हो रहा है बेटा? एक मिनट चेक कर लेते. Audio echo हो रहा है क्या बेटा? अभी भी audio echo हो रहा है? Now it is okay. Audio is fine. Now. Okay, audio is fine. Okay, wait. Audio is fine. So this was a question. You can see this is if the patient is stable. ध्यान से सुना. If patient is stable and if the patient is showing all the stable vitals. Okay. Audio is fine. Okay. So if patient is stable, now anyone can tell me what is the next step of management? Tell me dear, this one. Yes. What is the next step of management? Anyone? Is it ASV anti-snake venom? Is it immobilization? Is it venom suction? Or see the snake brought by relative? Tell me, what is your answer? A, B, C, D. आपको क्या देना? What is the first step of management? अच्छा, ये कह रहे हैं कि the anti-snake mention was 5,000 unit. Okay, that doesn't matter because they are asking the first step of management. Now, my dear friend, if this kind of finding is there, this is, as you can see, I taught in the PrepLadder classes, the first step of management is a right strategy. What is the right strategy? If you see, what is the right strategy? Reassurance, immobilization, yes. Go to hospital, tell the symptom and history to the doctor. Okay. Now, only case where we give anti-snake venom if you have severe local finding or severe systemic bleeding. Okay. Severe local finding or severe systemic bleeding, which is not mentioned here. Which is not mentioned here. So, as you can see, it is the local site you have. As you can see the picture, it is local site you have bleeding pain at the site of bite. So, here the best answer will be, immobilization. है ना? But अगर ऐसा दिया होगा if the symptoms, systemic symptom are there कि भाई आपके like there is a bleeding in your body, bleeding at a profuse bleeding, epistaxis, if these kind of symptoms are given now, then you can go for anti-snake venom as the first line of management. But according to me, if these findings are given, the answer will be immobilization. Is it clear, beta? Is it clear? बोलो बेटा अगर ये दिया हुआ हो तो ओके चलो नेक्स्ट बहुत इजी ब्लड ड्यूरिंग द ऑटोप्सी इज प्रिजर्व्ड ब्लड इन ऑटोप्सी इज प्रिजर्व्ड अच्छा एंटीस्नेक venom था एंटीस्नेक venom is I guess here also anti-snake venom is given don't worry but sir anti-snake venom is given if you have systemic symptom or severe local symptom systemic symptom or severe local symptom okay मोहम्मद तैयब समझ में आ गया बेटा blood during the autopsy is preserved देखो सर two questions are different blood during the autopsy are preserved and organ during the autopsy are preserved. If blood during the autopsy are preserved, that is sodium chloride. It is sodium chloride. Is it clear? And organ during the autopsy are preserved. That the ideal is rectified spirit and the second is sodium chloride. Okay. But I think the question was blood during the autopsy or organ during the autopsy. Tell me here. Blood during the autopsy or organ during the autopsy? Anyone? बताओ बेटा. Blood था. खत्म. खत्म खत्म खत्म. इससे ज्यादा नहीं करना the measurement of the rifle actually sir it was a very long question yes it is stored in the sodium chloride because sodium chloride inhibits the enolase enzyme of glycolysis है ना biochemistry में पढ़ते हैं ना that's the reason in measurement rifle barrel what is the caliber actually it was a long question given a long barrel is there how to measure the rifle or caliber actually the main point is how to measure the caliber how to measure the caliber how to measure the caliber? Caliber is the distance between two opposite lengths. Very simple question. The number of lead pellet, it decides bore. The number of lead pellet, it decides the bore. But actually, sir, it is a rifled weapon. That's why the caliber was asked. And you can see my notes. Yes, this is very simple. What is caliber? Caliber is a distance between two opposite lengths. And the bore is number of pellet. This was given in your PrepLadder notes very simply. है ना दोनों देख लेना और all the notes are directly from like if you see all the questions are directly from notes it is very simply explained what is a caliber and what is a bore what is yet it's a distance between two opposite lengths चलिए ये बताओ बेटा during the it's very simple question during the forensic examination of semen of rape victim ध्यान से देखना बेटा it is a rape victim the identification of distinctive yellow needle crystals was given now tell me yellow color was given, needle like crystal was given or not? Give me the answer. It was given or not? Because there are many people. It was given or not? Yellow needle like crystal. ये दिया हुआ था क्या बेटा? It was given or not? Yellow needle crystal. हाँ बेटा? Was it given? Okay, yellow needle crystal was given or not? Is it a sound issue? Sound का echo आ रहा है क्या बेटा? No. Okay, it was not given. But if you get a question, the needle-like crystals are given, no sound. Okay, अच्छा ठीक है. So they didn't mention yellow crystal. They mentioned needle-like crystal. Needle-like crystal mention किया था. Okay. Yellow crystal or needle-like crystal, whatever is given, the answer will be Barberio's test. And of this I discussed. Barberio's decides spermine. This was given. Yes. Dry semen. If dry semen is given and the yellow needle shaped crystal was given सारे क्वेश्चन LRR से थे very good sir अच्छी बात है वाह it is dry semen or whatever it is given but it is needle shaped crystal was given it was Barberio's how to remember S it is spermine crystal है ना and as you can see this is Barber वाला this is Florence test the brown crystal as you can see it is brown shaped crystal ये मैंने LRR में पढ़ाया था it was a Florence test choline how to remember Florence has C for choline crystal okay just like a wow चलो सारे क्वेश्चन इजी थे ये बताओ बेटा during a police investigation the bones are recovered from a crime what key characteristic will be crucial between human and animal the many people are saying the animal was returned and many are saying the canine's bones were returned okay Kohli wala, yes. So adding forensic analysis. What will be the best test for species? Anyone? Very important. ये भी LRR में mention किया था. What is the best test for species? Anyone? Tell me, dear. It is precipitine test. Yes, it is precipitine test. Very good, sir. As you can see, even if it is animal is given, canine bones are given, everything will be precipitine test. Animal only. Okay, done. So this is I discussed in my PrepLadder classes. Precipitine test is done for species. Precipitine test is done for species. Okay, bone difference था. How to differentiate the bone? For species of bone, we do precipitine test. Okay. हैंडकरचीफ वाले पे आते बेटा, अभी हैंडकरचीफ वाले पे आते, वो थोड़ा ट्रिकी क्वेश्चन था. ये आगे बेटा, नाम लेते ही आगे. हैंडकरचीफ. If you have two handkerchiefs with blood stain are found at the crime scene, what is the most appropriate procedure for handling these items? Actually, sir, I have seen many options, but I have picked 5 of the options. Place in the same plastic bag and seal it for preservation. Rinse the blood stain with water. Preserve the blood stain in envelope and paper bag. Okay. Audio is cracking. Audio beta normal है या audio is cracking? Place them in different plastic bag and seal it for preservation. Dry by split lamp to prevent putrefaction. Okay. Now listen, my dear friend. We are not putting in the plastic bag. First of all, please remove the plastic bag. Okay. Water वाला option में नहीं था. I will remove the water also because this is not a right option. This is not the right option. So what is the most appropriate? What is the most appropriate? Audio is not good. अभी भी audio सही नहीं आ रहा है बेटा? अभी भी audio सही नहीं आ रहा? The one handkerchief has to be folded in that manner. Okay. अच्छा, इसमें पूछा था नहीं करना है. What has not to be done? You have not to use the plastic bag first of all. Remember here. Okay. Not good audio. Doesn't matter Sugandha, not good audio, but ठीक है. अभी हम check उसमें अभी ज़्यादा करना नहीं है. But sir, here the best answer is we are not putting in the plastic bag. We will put in the envelope, paper or some bandage. उसमें क्या करना था, क्या पूछा था? Because these all the things which are not done. This is not done. This is not done. We won't dry it in split lamp. Okay. Dry semen was mentioned, but still, if the yellow needle crystal was given, that is a Barberou's test. Okay. But anyway, sir, without any doubt, we will use envelope or paper bag. We will use, yes, best method is envelope or paper bag. ठीक है? चलो कोई बात नहीं. Seatbelt injury, which is the most common organ involved? Anyone? What is the correct? Yes, both is are telling me what is the correct. Seatbelt injury, what is the most common organ involved? Tell me, dear, it is. Now, here mesentery is not given in option. Here, mesentery is not given in option. If mesentery is not given in option, please don't go for sir. आप गलती कर दो. You are doing a wrong thing. Spleen is the best organ for blunt trauma. Spleen is the best organ for blunt trauma. Even if the option is liver and spleen. चलो मैं आपका ये option भी कर लेता हूँ. Even if the option is, नहीं बेटा, seat belt injury हमने भी पढ़ाई है. Seat belt injury is also the question of forensic medicine. Even if the question is spleen, it is by blunt trauma. Liver and spleen, that is not, because the most common organ injured is mesentery. Yes, and after mesentery, because it is not given, the best answer is holoviscus. एक option में there will be head of the pancreas, so I will add head of the pancreas. Okay, dear. Okay, dear. Don't let touch the blood stain with each other. That is also good. But listen, my dear friend, we will use paper or envelope for blood stain. Yes, holoviscera is correct answer. आगे चलते हैं. Unknown substance consumption leading tachycardia and red colored halo. ये आया था. It's a kind of like he can see the red colored halo, or I would say it is a kind of hallucination. It is a kind of hallucination. Yes. Without any doubt, this is hallucinogenic drug, that is LSD. And you can see this I discussed in LSD. This is the picture I discussed in LSD. Very, very important note. I told you it is visual hallucination. As you can see, it is visual hallucination are seen in LSD. This I mentioned. LSD. Lysergic acid diethylamide. है ना? पूरा. Tachycardia was mentioned. Okay, no problem. It is change in the serotonin. Actually, LSD is because of changes in the serotonin. A bomb shock, I will come to that question also, don't worry. The most common organ injured in air blast shock wave. Without any doubt, what is your answer? I will tell you. Agitation and urination. Agitation and urination, I will tell you, don't worry. It is agitation or urination में option क्या क्या थे बेटा? Yes, without any doubt, it is lungs. It is lungs. मेरे हिसाब से forensic paper was little bit tricky, but it was easy. अच्छा, इस ऑप्शन में एयर ब्लास्ट वो वेव में स्केलेटल मसल भी था, यू आर टेलिंग मी, है ना? ओके, ये लंग हो गया ना? इट्स वेरी सिंपल क्वेश्चन. क्रैक, हेरोइन, कोकेन. तो सब क्रैक एंड कोकेन बोथ आर सेम. Crack and cocaine both are seen. Sir, bone was also an option, doesn't matter. But here you will pick the lungs. Dry semen in underwear. Only dry semen word is used. Nothing, the needle, the microscopic finding or yellow needle is not given. Then you can pick the acid phosphatase. Acid phosphatase. अच्छा. Belladonna, datura, pellet. चलो. हाँ, it is multiple intake of cocaine. It is the lungs. अभी आते बेटा, अभी लास्ट में आ जाऊंगा. Death sentence can be given by session court, additional session court, high court, session court and additional session court. ये मैंने पढ़ाया था आपको. As you can see. Anyone? Death sentence is given by which court? It is, if you see, what are the court which give you death sentence? Number 1, Supreme Court. ध्यान से देखना. Supreme Court. Number 2, High Court. Number 3, District Session Court. And number 4, Additional Session Court. चलो, High Court was not in option, doesn't matter. Okay. But if there is a dried semen sample, it will be acid phosphatase test. Chief Judicial Magistrate is not the answer. So I can write down Chief Judicial Magistrate. But this is not the answer. Okay. High Court was not the answer. But sir, here you will see the Session Court and Additional Session Court are the two magistrates which can give you death sentence. High Court also can give you death sentence, but the best answer, because these are the two courts, so High Court was not in option, you can remove that. Okay. Session Court, Additional Session Court, but the best answer will be Session plus Additional Session Court. High Court was not in option. चलो कोई बात नहीं. Many question, 3 question of MTP. Magistrate was there in option, but magistrate is not giving the death sentence. We have 3 magistrate: Chief Judicial Magistrate, First Class Judicial Magistrate, Second Class Judicial Magistrate. है ना? JJJ. Okay, done. Mentally challenged female, consent required for MTP. Who gives the consent for mentally challenged female? Give me the answer. Okay, so they are asking who is the in charge of that female? Legal guardian. ये तो बहुत simple question है. Legal guardian gives the consent for mentally challenged people. According to MTP Act, the 22 weeks due to contraceptive failure. Okay, there is a pregnancy due to contraceptive failure. 22 weeks of gestation required MTP. Tell me, dear. अब दोस्तों, if you remember, I told you this one, very important. Listen very, very carefully. This MTP law. See, up to 20 weeks we require for contraceptive failure, pregnancy, rape, incest, vulnerable female. We require up to 24 weeks. है ना? Creatinine kinase is for old stain, beta. Fetal anomaly was given in option dot. Okay, but sir, very simple question. It is a very simple question. For contraceptive failure, we can go for MTP only up to 20 weeks. है ना? तो इसका मतलब contraceptive failure के कारण, if you have pregnancy and you are going at the age of 22 weeks, it means MTP can be done or cannot be done. Give me the answer. Tell me, dear, can be done or cannot be done? बोलो बोलो. चलो इस क्वेश्चन पे वापस आ जाता हूं. Here the question is asked: the patient went at the 22 weeks of pregnancy. It was fetal anomaly or contraceptive failure? If it is a contraceptive failure, it cannot be done. चलो ये तो हो गया इसका आंसर. If it is a contraceptive failure, it cannot be done. That question is different. By 2 doctor, that question is different. If it is due to contraceptive failure, it cannot be done. Okay? Okay? At the 22 weeks of the pregnancy due to contraceptive failure MTP cannot be done. अब मैं आता हूं दूसरे क्वेश्चन पे, ध्यान से सुनना, ठीक है? क्योंकि this is I told you up to contraceptive failure up to 20 weeks, rape, incest up to 24 weeks, any fetus abnormality that is more than 24 weeks, even we can go, and any time if mother life is in danger, anytime, yes, anytime if mother life is in danger. And also who makes the medical board? 4 doctor, 4 लोग, obs gynae, radiologist, pediatrician, and any other member which is a gazetted officer. Okay, who can do an MTP? Who is a registered medical practitioner, assisted 25 MTP, 6-month house job, OBG MD MS diploma, 1 year experience in OBG department. ये आपको ध्यान रखना. चलो अब आ जाओ. Listen my dear friend, this is done, and now we are coming to very important point. This one, हाँ ये देखो, MTP which is punishable means which is not ethical. The word was given punishable or not ethical. Which word was given? Which word was given? Punishable or not ethical? Tell me. क्या वर्ड दिया हुआ था बेटा? Which word was given? It was punishable or not ethical? अच्छा, which is offense? Okay, done. So that is punishable. Very good, sir. You can see MTP done up to 24 weeks. That is legal. That is legal. Done by government authorized center. अभी मैंने बताया था. Done, sir. Yes. Done by experienced RMP. अभी बताया था. Which is if you non-entry of MTP register. Yes. Non-entry of MTP register and not sending report to the district health officer. Yes. Not reporting. Okay. Not reporting. Not sending report. That is not reporting. Very good, sir. बहुत अच्छी बात. Not reporting and sending it to DDHS. D option नहीं था. Non-entry or not sending report. Not reporting. अच्छा, for 1 month. हाँ, that is okay. If you are not reporting, not sending report, that will be the answer. Because every MTP has to be reported. Every MTP has to be reported. Yes, yes, that is the right answer. Okay, sir. So these are the questions which are very important. Is it clear, sir? One more question the person is telling, the urination, agitation, which question was there? Crack, heroin, cannabis, datura. Which condition have serious agitation seen in the agitation and urine passing? Urine passing. Acute liver failure. What was the question of acute liver failure, Nishan? What was the question of acute liver failure? चलो इसको भी लिख देते हैं. Acute liver failure. Question क्या था बेटा? हाँ, blood हो गया बेटा. Blood examination हो गया. Acute liver failure. Which poison? Datura. अच्छा, acute liver failure is due to which toxin? Option was morphine, drug abuse, अच्छा, followed by hematuria, organophosphate, morphine, atropa, organophosphate. हाँ, एक ऑप्शन और था सर, वो ए से ही था, स्टार्ट था. Phosphorus was an option. Amanita, mushroom. Amanita, mushroom. बेटा अगर मशरूम दिया हो तो मशरूम कैन लीड एक्यूट लिवर फेलियर. Amanita was an option. No, actually there was one question regarding the ketamine. Okay. Ketamine was a question because ketamine increases all the things. Ketamine increases all the things. You are getting confused between two questions here. You are getting confused between two questions. Increase secretion or diarrhea, was that a question? increased secretion or diarrhea, was that a question? मैंने तो एमनीटा मार्क किया था. ओके, एमनीटा और कीटामाइन. सुगंधा पांडे ये बोल रही है. ओके, acute liver failure in eminenta phylloids or other options. Sir, blood for we will store in sodium chloride. Millard Ashraf will store in sodium chloride. Ketamine was another question. I think ketamine was a question of urination and diarrhea, or like I think salivation. That was a question. Ketamine was a question of increased secretion or diarrhea. Was that a question? Now they are asking too much question for toxicology. 10% formalin was the option, but that is not the answer. Formalin is used for histopathology. अच्छा, anesthesia का था. That was for anesthesia. Increased secretion, increased pressure. आपको मालूम है ketamine increases the whole pressure. That's the blood pressure, respiratory rate, everything is increased in ketamine. Okay. Multiple drug abuse. Propofol and ketamine was the option. That is the question of anesthesia. Don't worry. Okay. Last वाले का MTP, which is punishable, non-entry or not reporting it to the center, है ना? The cause of liver failure, morphine और कौन सा बेटा? Atropa, belladonna, datura, amnita. क्रोनिक एल्कोहलिक का सैंपल देखो, इनमें से अगर कोई पूछा जाए कि मॉर्फिन, दतूरा, बेलेडोना, एमनिटा, इनमें से तो यू कैन पिक एमनिटा. मेरे को जो लग रहा है एक्यूट लीवर फेलियर है ना. हाँ, we'll use the sodium chloride for blood. Sodium chloride. Yes. History of RTA with alcohol intake was given. How do we store the blood in sodium chloride? Okay. Yes, very good. आरिफ ने एकदम सही सवाल दे दिया. Very good. ठीक है. Propofol और ketamine का question was related with anesthesia. That ketamine increases all things. There is a tachycardia. There is an increased secretion. Okay, dear. So, anyways, there are 13 to 14 MCQ from forensic medicine, and 3 are from MTP Act. The last time also the 3 questions from handkerchief वाला हो गया बेटा. We'll use the paper bag or envelope for answer, and we are not using the plastic bag. We are not using slip, that is a dry spirit. We are not using water. We are not rinsing it with water. Okay, ये मैंने पढ़ा दिया. Okay, so it is done. You can see that this handkerchief question, this one. LSD वाला हो गया, बहुत इजी क्वेश्चन था. होलो विस्कस होगा. So it is preserved in envelope or paper bag. Okay. So multiple drug abuse followed by hematuria. बेटा 22 weeks of pregnancy and if it is due to contraceptive failure, we are not going to do MTP. क्योंकि देखो बेटा, ये तो मैंने PrepLadder में पढ़ाया था ना. This was I explained here ना. You can see this one. Because in contraceptive failure, we can go for MTP up to 20 weeks only. Okay. And in these cases, it is up to 24 weeks. After 24 weeks, generally we can go for if there is a congenital malformation. Okay, some last option. Some last option that was if you are not reporting it to the authority or you are not making an entry. Yes. When can a MTP be done in a female with contraceptive failure? Option 1 with one doctor opinion, permission from the court, fetal anomaly. Some last option. What was the some last option? If the question comes in exam, if the contraceptive failure is not given, and if you have 22 weeks of MTP, okay, you will require 2 doctors' opinion. 2 doctors' opinion. Crack morphine opioid for multiple drug abuse followed by hematuria. अगर ऐसा हो कि like 22 weeks and nothing has been mentioned, we require the opinion of 2 doctors. Okay, friends. So anyways, there are two questions which are confusing, like the one is ketamine and propofol, and the second question is the multiple drug abuse subsequently, that is hematuria, na? But the options are still confusing. Crack is cocaine, morphine, opioid. Contraceptive failure is up to 20 weeks only. So if it is 22 weeks, so we cannot do for contraceptive failure. Okay. Chalo, leave it here. Don't worry. I'll discuss. If the one question is left, I will discuss that, and I will see that question. I will put in the comment box about that. Please send me that question in the comment box also. Exactly the question, like the multiple. The hematuria wala. वो भेज देना. The ketamine is a question of anesthesia. अब ये बताओ मल्टीपल ड्रग अब्यूज है, दैट इज प्रोबेबली बिकॉज ऑफ multiple drug abuser is because of which one? Opioid, cannabis, morphine is a opioid. Okay. एक बार मेरे को ये क्वेश्चन आप कमेंट बॉक्स में डाल देना. आई विल सी द एग्जैक्ट क्वेश्चन मल्टीपल ड्रग अब्यूज फॉलोड बाय हिमेचूरिया. ओके, एक बार मेरे को ऑप्शन के साथ भेज देना. बट these are the 13 to 14 MCQ. Ketamine and propofol is related with that anesthesia. Okay, so don't worry. Best wishes for your exam. Keep smiling. Good luck. Goodbye. अच्छा रिजल्ट आएगा, आप मेहनत करते रहो. ठीक है बेटा. चलो, बाय बाय. टेक केयर.